So, as you guys know, J&J 4528, now known as Ciltacabtagene Autoleucel, or cilta-cel, is a structurally distinct second-generation chimeric antigen T-cell receptor with two BCMA binding domains. In the past meetings, we presented data on the phase 1b portion of the CARTITUDE-1 study, and today I'll be presenting the combined phase 1b and phase 2 data on the CARTITUDE-1 study. So here you can see the primary objectives, which we've mentioned before, the same. The phase 1b was to characterize the safety and confirm the recommended phase 2 dose. And then the primary objective of the phase 2 was to evaluate efficacy. The key eligibility are pretty similar to all the CAR-Ts that we've seen out there so far. They all have to have progressive multiple myeloma. They have to have good performance status with measurable disease, and they have to have been exposed to at least 3 or more therapies or be double refractory, including PI, IMiD, and anti-CD38. Here in the middle, you'll see the study design, which I'm not going to go into, but I just wanted to point out that the target dose for cilta-cel is 0.75 million CAR-T cells per kilogram of body weight. Here to the right, you can see the key baseline characteristics. So we apheresed a total of 113 patients, out of which 101 underwent lymphodepletion, and 97 patients ended up getting treated with cilta-cel, with a median age of 61, and about more than half were 58% were male. And if you look at these prior treatments, you can see these patients are quite heavily pretreated, as their median priors of therapy was 6, and it ranged anywhere from 3 to 18. 88% of these patients were triple refractory, 42% were penta-refractory, and one thing of note is the study didn't require you to be refractory to your last line of therapy, but actually 99% of these patients were refractory. You can go to the next slide. Since we are only focusing on a few slides, I kind of put all the key safety findings in one slide. As you guys know, for CAR-T, CRS is the most common side effect that you usually see. And here you can see that all but 5 patients had CRS, with 95% of these patients being mostly grade 1 and 2. One key point I wanted to point out is the median time of onset of CRS, which is 7 days here, with 89% of the patients having CRS onset at day 4 or later, and 74% having it at day 6 or later. And to the right here, we can talk about neurotoxicity, which is another known complication with CAR-T studies. And you can see that the total CAR-T cell neurotoxicity was 21%, with grade 3 or higher being about 10%. And these CAR-T cell neurotoxicities can be further classified into 2 groups. So we have ICANS and other neurotoxicities, with significant overlap between these 2 categories. So the 16 patients who had ICANS mostly had grade 1 and 2 ICANS, and all patients with ICANS actually had resolution of their symptoms within a few days. The other neurotoxicities, we had 12 patients that had other neurotoxicities, which either occurred after resolution of CRS and or ICANS. So 5 of these patients had movement and neurocognitive changes, while 7 had symptoms of nerve palsy or peripheral motor neuropathy. And these neurotoxicities resolved in 6 patients and did not resolve in another additional 6 patients. One thing of note is that we actually did not see any more additional movement and neurocognitive AEs in the ongoing CARTITUDE studies. And here on the bottom, you can see the total deaths on the study. So there was 14 patients who passed away while being on the study. 5 were due to progressive disease, 3 were unrelated to treatment, and 6 were related to treatment. You can go to the next slide. So here we can look at the overall response rate. The overall response rate was 97% with 67% stringent CR. What's more interesting is that 70 patients are still on treatment at the time of data cutoff, which was 12.4 months. And if you looked at the MRD evaluable patients, 93% of the evaluable patients were MRD negative at 10 to the minus 5 and median of 1 month. And here to the right, you can see our PFS curve, and you can see that the 12-month PFS rate was 77%, and we did not reach an overall median PFS at this time. The 12-month PFS, if we actually broke it down by response, the stringent CR rate was 85%, and the overall the overall survival rate for 12 months was 89%. We can go to the last slide. So in conclusion, we saw the cilta-cel had a manageable safety profile at the recommended phase 2 dose with mostly grade 1 and 2 CRS, with the median onset of CRS at 7 days. We did see some CAR T-cell related neurotoxicities in about 20%, with 10% having grade 3 or higher. So in conclusion, we can say that we had a low dose of cilta-cel, which yielded early, deep, and durable responses in this heavily pretreated population with a 97% overall response rate and 67% stringent CR. Thank you.